Hello and welcome to the Healthology podcast. I'm your host, Dr. Eckel, and my guest for this session is Dr. Greg Eckel. Dr. Greg is trained in family practice and maintains a particular interest in neurodegenerative disorders, including Parkinson's disease, multiple sclerosis, traumatic brain injuries, headaches, migraines, and post-stroke recovery. He has developed his own very successful brain regenerative program that has helped thousands of patients to date. The combination of naturopathic and Chinese medicine has provided Dr. Greg with a variety of tools to treat both acute and chronic illness while valuing the principles of prevention and wellness. So Greg, welcome.
Hey, thank you so much for having me on.
I wanted to just get started by asking you how you became so passionate about helping people recover their brain function, because you've got a bit of a personal story, and I wonder whether you'd be willing to share.
Yeah, for sure. So I have been in medicine for 20 years. I opened my practice in Portland, Oregon in 2001. And we grew into one of the largest integrative naturopathic clinics in the world, really. I have people travel in from around the globe. And was doing, had multiple physicians and, had different sizes, shapes, structures of the clinic. And eventually my wife, Soraya, came into the practice. She was a certified nurse midwife, nurse practitioner, and had been in the practice for about 5 years. And all of a sudden started having memory issues. She's early 40s, thinking, well, geez, is this going to be, like, what's going on? Like, we're staying later in the clinic. We had been leaving like 5:30, 6 o'clock after seeing a, full load of patients every day. Everything's peachy. We had 5 kids between the two of us. And then all of a sudden, it's like every day where I'm like, honey, what's going on? She's like, hey, I've had really difficult cases. I'm just being diligent in the chart. It's like, okay, well, over a couple weeks, it became very evident. It was like something is going on with her memory. And she started to notice it too. But it was a very rapid progression of memory loss. Like all of a sudden now patients were coming up saying, hey, Soraya is really repeating herself here. What's going on? Said, oh, she's stressed. And so we started evaluating, okay, what causes early memory loss in a 40-year-old? So we looked at, is it perimenopause? We evaluated her hormones. Is it mold? So we looked at mold and mold toxicity. I had the whole clinic in our home, really worked up for mold. And we, tested her urine for mycotoxins, and it wasn't that. So we kept going down, into, well, maybe there's some type of infection or, just more of the things that would cause that in a 40-year-old. And then, as the weeks rolled by, it started to get into more ominous diagnosis of like, I kind of reached my end here, my 18 years of clinical practice at that point. I'd never seen anything like it. So I went into conventional land. And, I know what's happening in the medical system. It is so fractionated and busted. But to go through it with a loved one near and dear, it's even more heartbreaking. It is so fractionated. Like, I went to psychiatrists, psychologists. We went to another functional medicine. We had our brain imaged with a SPECT analysis. And I was getting like, oh, this is a psychotic break. I'm like, this is a high functioning, top of the line midwife. Such joy in practice. And, within a month, basically, Soraya she wasn't able to speak. So we had to change the schedule. I took her for evaluations, and it was just within 2 months she was gone. It was such a rapid progression. And what was on that differential was Creutzfeldt-Jakob disease, which is a very rare neurodegenerative condition. It's 1 in a million. There's about 300 cases in North America a year. So super rare. So here I find myself, swinging for the fence as loving husband and practitioner. And it was totally heartbreaking, being, no known cure to date. You might remember this in Europe. with all of the tainted beef from mad cow syndrome. That is what Creutzfeldt-Jakob disease is in humans. It's called scrappy in sheep. It's wasting, chronic wasting disease in deer. So a lot of our animal species have these prions, which are misfolded proteins. Well, the only thing with this, and this is with all neurodegenerative diseases, except for maybe now MS, we have some imaging and monoclonal antibodies that we could measure in cerebral spinal fluid. It's a clinical diagnosis. So, you know, Case Western, they offered to enroll Soraya in their study. They had 26 people in it. It was a video conference like this, and then they offer you a free brain biopsy at the end to see, did she really have Creutzfeldt-Jakob disease? You know, it was like, oh, you're kidding me. And in the end, they didn't even allow her in just because of all of the therapies that I was doing with her. They didn't want any part to do with the case. So that, it really, you know, I went through it as loving husband and partner and as practitioner. And really what it did, what I'm sharing with folks, is what I'm calling Soraya's gifts. So unfortunately, what I uncovered did not help Soraya. However, it is helping thousands of people. I wrote about it in my book, Shake It Off, an integrative approach to Parkinson's solutions that we'll talk about today. I also, you know, I have a destination clinic here in Oregon that people fly in for these treatments. And it's, you know, it's heartbreaking. It's use my tragedy so you don't have to recreate the wheel. But it's like, you know, basically I wanted to make something of this. I didn't go through it for naught. It's a brutal journey sometimes, this life. You know, none of us get out of here alive. But, you know, the gifts of the journey, you know, I had an amazing relationship for 10 years. I'm so grateful for every moment I had with her. And, you know,
I'm so sorry.
it's, you know, it's a little bit on the grief front, on just a human level. You know, I'm not a grief ambassador, but I don't think we do grief well in around the globe. So, you know, I really got schooled in that, how to come out whole, you know, how to have your emotions, not stuff them, you know, not using substances or behaviors to, you know, ignore what is actually going on in your body. And really, you know, opening your heart to the whole process. So, you know, in a weird way, the whole journey has kind of ripped me open as a human. It's reinstated my faith, and in such an odd way that I get to talk about it here. You know, I really do have the belief we are all one. Pretending to be separate in this reality. And so, you know, I signed up in medicine to serve. I want to use my journey as inspiration to others. I get loss on a very intimate level. And I just want to share and be of service to your listeners, your viewers, and to the people of the planet, because that's what we're doing here.
Yeah, I thank you so much for sharing this so generously and so openly. And like I said, I just even can't even begin to imagine. But it's true, you know. I work with trauma, and you know that I'm quite big on properly dealing with emotional challenges, because we can't just sit on it, and we can't pretend that it's not a problem, or dismiss it, or put it in a little box inside our heads, because obviously that will then affect the physical. And so it's such an important piece as well that you've touched on here. And you certainly, you know, the story is inspirational, and the fact that you're using this as a gift is huge. When people get to this point in their journey, when they actually look back and they can see even a little bit of light of something positive, something good, and use their experience in this way, then that's definitely a massive journey of self-development to get to that point, that's for sure. And I know a bit about that myself. So let's talk about the prevalence of brain issues, Greg, because we know this is obviously, you already said you've helped thousands of patients along the way, and this yet is a problem that we know is on the rise. So let's talk a little bit, just highlight just how much of a problem this is and why that is the case.
Yeah, it's huge. So we are seeing a growing prevalence of brain disorders. So in the U.S., by the age of 65, it's predicted that there will be 50% of the population at the age of 65 will have some type of brain disorder. So dementia, Alzheimer's, mild cognitive impairment, which is the precursor to dementia. So 50%, 1 in 2 people will have an issue with the brain. Without your brain, you're not you, right? And so it is totally on the rise, and we're seeing that with regards to, I think, environmental toxicity, but also our history on the planet and these traumas that you're talking about. You know, one of the pathways that I got to was this ancestral traumas. You know, I'm seeing patients now. It's made my job as a clinician much harder, because it's like, oh, okay, here's this individual here, but what they're expressing in this moment may not be entirely there. It could have been their great-great-grandmother that had trauma that flipped the switch on their epigenetic, on their genetic platform, that then started to express in the generations to come. There's multiple levels to this discussion. And that's where I really think medicine is going, is that it's not just a biochemical physical body. We've got to address all of these levels for folks in a systematic way so that we get true deep source healing. Like, that's where it comes from. So, looking at, where did your ancestors come from? What is your genetic lineage? It doesn't mean you're destined for that to happen, but let's say you have Irish descent, and your ancestors went through the potato famine. Well, that triggered the genetic expression for that far back, so it's kind of that curse of you in 7 generations. Well, they're showing now in the research 12 generations of expression of the genetic, epigenetic influence on your genes expressing themselves. Now, good news is there's a lot of things that we can do to reverse that. But I think, so one, traumas, ancestral traumas, and traumas in this lifetime are definitely a big player. Then you add on to that environmental toxicity, which I'll talk about in the assessment component of kind of my brain regeneration protocol, what I put together. You look at heavy metals, North America, again, that's where I've got my data. Mercury, cadmium, arsenic, and lead, top 4 metals that I find in most folks with some neurodegeneration. Well, why is that? We store toxins in our fat. We could affectionately call each other fatheads, right? 60% of our brains are fat. And so we store toxins in fat. So if you don't uncover that, so there's, these are the things that I want to bring to light and share with folks, because this is how you have to think about it. This is why there's been no breakthroughs in neurodegeneration for centuries,
Yeah, absolutely. Thank you for touching on intergenerational trauma. Certainly, another great example of this, and there is some research, is Holocaust survivors, of course. So yes, very, very, very important to actually take that into account alongside other things that obviously are important to address on the healing journey when it comes to healing the brain and the nervous system. Could you talk a little bit more about some of the early signs and symptoms? Because you've mentioned with your wife, the memory loss, certainly that was one of them, but there obviously will be some other early signs and symptoms that people can look out for.
Yeah, there's some really early ones. So we are showing up to 2 decades, 3 decades before like the noticeable signs. So for instance, in Parkinson's disease, it could be a loss of sense of smell. Now, this could be with any brain degeneration, right? You think about it, you see patients like, oh yeah, I can't smell anything. Well, that's a cranial nerve number 1. That's your olfactory nerve. That's why essential oils are such a great way of treating folks, right? Of that access. But when you can't smell, 1, it could be a simple zinc deficiency, but 2, it also is registering as, oh, you have brain degradation. That's your brain not registering a sense. And so that can happen up to 2 decades prior. Constipation, it's rampant around the globe, right? Of like, oh, I'll see patients, they say, well, geez, I don't have a bowel movement for a week. It's like, holy cow, you're literally full of it, right? And you're recycling those wastes that we're supposed to be eliminating on a day-to-day basis. So that's that gut brain connection, but it's also an early symptom. And in conventional medicine, it's like constipation. Oh, just take some Metamucil or fiber supplements and you'll be fine. It's like, no, that's a big deal in my world, because that could be early signs of brain degeneration. Another weird interesting one is, Alan Alda of MASH fame, and I don't know if your viewers, this could be before everybody's time, but I'm getting up there in age. So MASH was a show in the States of kind of the Army units. So Alan Alda, famous actor, he read in the New York Times article on early symptom of Parkinson's is you could be acting out your dreams. And what he was doing was he woke up hitting his wife with his pillow, and he thought it was like a sack of potatoes and there was some attacker coming at him. And he went in and he actually got the diagnosis. So he had no other symptoms other than that acting out his dreams as an early sign or symptom. Of course, memory loss. So, and these are things around, all too often I hear my patient base say, oh, my provider just said, get used to it, you're getting old, or, oh, I'm having senior moments. Like, this is not funny. Like, this is actually, these are signs that your brain is under duress and you have to take action. I'm willing to take a stand for people. I put the flag in the ground because I'm so passionate about it, because these things are reversible, so.
Exactly, and that's the point, that if we catch this early enough and not let it go into stage whatever of this problem, then we can really, really do something. But by the time a lot of people get their official diagnosis from a Rockefeller medicine practitioner, then we know that by that point we've got a real problem, and it's going to be real hard to do anything about it.
Exactly. It's so end stage. It's like the tip of the iceberg. It's when you pop up to that point to get that diagnosis. It's like, oh my gosh, there's so much we have to unravel. And sometimes it's hard to come back from that. So the preventative component, like in your 30s, 40s, like this is the time to get on it. Now, if you're in your 60s and 70s and listening, it's not too late. We'll talk about some therapies towards the end of the show today that I found to be effective at helping reverse that decline. But if we can prevent it, of course, that's the way to do it.
Indeed. And you talked about constipation, and clearly constipation is one actually of key signs that your vagus nerve function is poor, and I was talking about that a lot in the event that I did on the vagus. So obviously this is all connected. Clearly it's not just a separate coincidental sort of thing, right? It's all connected. So could you explain about the assessment stage? Because obviously if we onto something here, maybe there are some early signs. How can people sort of act on it in terms of assessing what is really going on?
Yeah, and that is so crucial. So in my fancy approach, it's FANC, my fancy approach to brain regeneration. The A is assessment. And this one, I am talking to people around the globe with Parkinson's diagnosis, with Alzheimer's, dementia, or their family members that have that support for those folks. And this never gets looked at, right? People just get parked with a diagnosis or even an unknowingness of like, we don't know what's going on with you here. Take this Cinemet for Parkinson's, or, maybe here's some, cognitive decline meds, but nothing really gets at the underlying root imbalance. And so 3 areas that are crucial. Now, this is not everything, but these 3 areas really have to be looked at. And I would recommend all of your listeners every year getting these as your checkpoints, because this is a functional medicine approach. 1, the heavy metal component. You got to rule it in or rule it out. Not everybody with brain degeneration has a metal issue, but definitely a high proportion of people. And if you have metals in your body, that doesn't matter what kind of fancy therapy we throw on top of that, those metals are just stopping that from being effective. So heavy metal test, and I like to do an active chelating agent. With that, if you're in the clinic, we do an IV of EDTA. If you're at your house, we do oral DMSA, but you got to take a chelating agent to pull that stuff. The second component of testing, so we have the heavy metals, definitely you got to get those ruled in or ruled out. Stool analysis and the microbiome assessment. This is crucial, right? We know the stomach is the second brain. Your neurotransmitters, dopamine, serotonin, melatonin, all manufactured in the gut. If you have imbalances in your gut, your brain is not going to function as well, believe it or not. It's true. There's tons of research coming out on it. So we look at the microbiome, we look at inflammation, we look at, what's going on with your immune system around your gut. 90% of your immune system is called the GALT, the gut-associated lymphoid tissue. It surrounds your gut, the tube that goes through your body. So we look at the microbiome. We look at imbalances of bacteria, opportunistic and pathogenic bacteria. Look at any viral illness in the gut as well. And then the third one is I do a urinalysis on your stress hormones and your sex hormones. So we look at estrogen, progesterone, testosterone, the metabolites of where those are getting broken down in the body, and then also the diurnal variation of cortisol, your stress. So, stress hormones should raise in the morning and then decrease throughout the day so that you're able to go to sleep and have deep, restful sleep. So we look at those three facets on an assessment, and 100% across the board, unless somebody has seen a functional medicine practitioner, they have not had that workup. And it's low-hanging fruit. These are things where if you uncover something in there, it's actionable and you can make a difference. I had a patient come in, his wife actually came in with him and said, I have my husband back. He had mild cognitive impairment, really slipping into dementia. We did a metal test on him as a starting spot, and we also did the stool analysis and the hormones as well. But the metals came back. He had a high lead burden. We got into 2 rounds of chelation therapy with him, and she came in and pronounced, I have my husband back. And he also agrees, like, he's present in the conversation. His wit is back. He's got his sharp tongue and sense of humor, and he's alive. We brought him back from slipping into that darkness of dementia. And I mean, what a joy for me to be able to say, wow, we found a really low-hanging fruit. Other providers are not looking at that. And it's ridiculous because we know there is a metal burden in people. It just isn't causing them their health problem, especially with neurodegeneration. So these are big, another one on the microbiome. You could have an imbalance there of a opportunistic bacteria. And if that's out of balance, that throws your whole immune system off. And then that starts to cause problems like a tremor in Parkinson's. And I've seen by balancing out the gut, folks' tremors improve. So these are actionable, treatable items. By no means am I saying I'm curing Parkinson's. However, we are helping people's quality of life significantly, and not by doing rocket science, by just doing basic functional medicine approach to brain health, and we're really helping a lot of people to get their lives back.
Yeah, and that's amazing. And thank you for sharing those case studies, because that is important for people to know, is that actually it's not always going to be super complicated. Sometimes those simple approaches can do an awful lot. So do you want to go ahead actually and then talk a little bit more about prevention and also treatment as you see it, as you do it in your clinic?
Sure. So there are the 2 big components on the preventative aspect. So one is assessment. But then, this is the non-sexy component, right? This is foundational work, like how's your sleep, right? If you are not hitting deep sleep, your brain isn't cleansing itself, right? When I went to medical school, we did not know about the glymphatics, right? Which is the lymphatic, the garbage system of the brain. We didn't even know that existed until 5-6 years ago. And so, well, what is that? So the brain actually shrinks in deep sleep and flushes the lymph fluid across it. And that's how we remove protein fragments, viruses, bacteria. It basically cleanses the brain. So if your sleep is off, or you've been working night shift or swing shift, you have sleep irregularity, that we want to correct immediately, because that's a foundational piece of rest and regenerate, the parasympathetic activity. And I know you talk a ton about this with the vagus nerve. of that's how the brain heals, is we get into that deep restful sleep. And you want it to be about 20% of your overall sleep total. So that's, on a preventative component, definitely we want to assess your sleep. We want to look at your diet and nutrition. And there's so much confusion around, what do I eat, doctor? And, stress, organics are huge. In the US, pesticides are in all conventional food, in particular glyphosate, which is a known neurotoxin. It also is known to cause cancer. So, I often hear, well, gosh, organics are so expensive. It's like, well, it's either you pay now or you pay a lot later. And I would rather you pay now, because getting the organics, one, you're helping you're helping your family, you're helping your community, you're helping your farmers, and you're helping the earth. It's a win, 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 win. Everybody wins with organics, because it's replenishing the earth, right? So we want to support that new economy. That's how we make change in the world, as we vote with our dollars. And so that is a big one, because when you get into glyphosate toxicity and or genetically modified organisms, so genetically modified food, that we have never seen that in our bodies, and that does not do well with our biochemistry or our physiology. Glyphosate in particular, Stephanie Senoff is a great researcher on that. She's showing that the glyphosate molecule comes into glycine in our DNA and basically makes the blueprint for every cell of our body. It ruins it, it wrecks it, and it causes all kinds of destruction in our bodies. So diet, nutrition, whole food diet. I really like Dr. Terry Walls. She's a medical doctor that has recovered from multiple sclerosis, predominantly using diet therapy. And she is a big proponent of a modified paleo diet. And that's generally that whole food component of a 40% complex carb, 30% really beneficial fat, 30% is your protein. It's simple. Like, I like to keep it very simple. I like the Walls protocol. It's a really great sound diet with some really great research behind it. I don't need to reinvent the wheel for folks. Occasionally, a lot of the times I will do food sensitivity testing for my patients to determine, because you could be eating really great organic superfoods and your body is reacting to them, causing inflammation. And so we want to make sure that's not happening. I'm more of a test, don't guess. But also I think there's a way that if we know we're going to treat most of the people in this fashion and they get better, well, let's start there. And if we're not getting the results, then we can throw in the assessment test component. So that's the diet, nutrition piece. And then exercise and movement. Exercise, again, loaded term. I like just to call it movement. One of the things, especially, just in light in general, I don't think we play enough. We get so serious as humans, so I ask, when's the last time you danced? When's the last time you sang? But dancing can be movement, walking. I like Qigong, which is Qi is energy, Gong is work. It's a kind of the precursor or overlying umbrella to Tai Chi in Chinese medicine. I actually went into Sichuan province in Tibet to learn a specific varietal of Qigong. We did 8 hours of Qigong a day for a month. It was awesome. It was the beginning of my Chinese medicine career, and I've carried that forward. So I have some videos that I've posted for folks in my book. I'm also a big proponent of cloud hands. It's coordinating the right and left hemisphere of the brain and helps with balance, and also visualization of healing. So just a simple blood flow, it increases BDNF, the brain-derived neurotropic factor. That's how our neurons regenerate. So the exercise is another big foundational component when you look at how do we prevent this from happening?
Oh, for sure. I couldn't agree more. I don't really, it's not possible to have good health without movement, whether it's brain health or otherwise. It's just not possible. We were designed to move as human beings, and sitting on the sofa, and even if you're taking lots of supplements and eating a good diet, it's just not going to be enough. You do need movement in your life. right? So
Right.
great. And yeah, Qigong is something that I've promoted a lot in, through the events that I'm doing. I've got a friend who is a Qigong master, and he says that we're approaching the time when Qigong will be actually more popular than yoga in the West, because it's just because of the simplicity of it.
Yeah. Interesting. Oh, that's great. I think, one of my teachers, I'll give him a shout out, Dr. Wong. It's the Jin Jiang school, which is the muscle tendon changing school of Qigong. And, it's very powerful, right? It's a mind-body medicine. What I love about Chinese medicine is there's no word for mind-body medicine. It's all heart-centered. The heart is the emperor or the empress. And that really, it's kind of one of the ways that I talk about what I do is I don't treat disease processes. I treat whole dynamic heart-centered beings moving through time and space. And to treat the human with, reverence and honoring the dynamics of our reality of what's going on here. It's such a refreshing way to practice of deep listening and presence. And, what I find is most people, if you listen deep enough, we know what's going on. You just need a trusted source to hear you and then reflect back, but also somebody that knows, like, this is the path, like this is how we do it, and also they're also willing to make up a new path for you individually, right? Because it's not one size fits all medicine. It's very personalized medicine. It's a hard way to really systematize an approach, but it is really what we're all doing now in the functional medicine realm, is really individualizing programs and treatments for people so that we get really deep, profound transformation. Like, that's really what I want to promote, and I really see it. And when it happens, it's so rewarding when people get their creativity back. It's what motivates me and gets me up to do interviews before work, before my busy day of seeing patients today, is to really help people understand, like, that is the more beautiful world our hearts know and desire. It's a Charles Eisenstein book that I highly recommend. Really can't exist. We just have to envision it, and we can really make it happen here. Like, this is an amazing, our globe, our planet Earth, Gaia, whatever, Mother Earth is so sustaining for us, and we just have to really honor and listen. And so on that deep listening, so that I got into that on the Qigong trail, but that energy work and that quieting, the centering of oneself and honoring our hearts is really integral to the work that I do.
Absolutely. And these are breath-based practices, and it's no coincidence that when we're talking about vagus nerve stimulation, we always talk about those sort of practices. So it's all connected, right? It's all right there. But talking about books, thank you for sharing that resource. Tell us a little bit more about your book, the book that you mentioned at the beginning, Shake It Off, the Integrative Approach to Parkinson's Solution.
Sure. So this is the one I basically codified or systematized my thinking process around kind of what I went through with Soraya. Now, you might be thinking, well, she had Creutzfeldt-Jakob disease, kind of mad cow syndrome in people. Why Parkinson's? Well, so I got in on the Prion textbook. I got the second edition. Stanley Prusiner got a Nobel Prize in 1987 out of UCSF for discovering prions. And so what is a prion? It's a misfolded protein. So it's not a virus. It's not a bacteria. It's a misfolded protein. And it's kind of weird because it doesn't have genetic material like other cells. So they're called, quote unquote, infectious prions, but there's no infection coming at you. They basically, they get signaled to misfold. And so when you get in on that textbook, well, you realize, oh, here's the link between, here's Parkinson's, here's Lewy body dementia, here's Alzheimer's, here's dementia itself. Here is Parkinson's disease with alpha-synuclein, which is a misfolded protein. Anxiety also has been put into that camp as well. And so there's this linkage, and nobody really is focused on these misfolded proteins. And so what I wanted to write about was Parkinson's, because I've had a large neurology practice. and had some patients in the clinic right then as I was going through that with Soraya. And what I was learning, to help Soraya, I was like, okay, how do we change a brain? Is what I put into the book. So in my fancy approach. So in there, I just share kind of my personal journey, but also how that's helping people clinically with stabilizing their tremors, getting their gait back, reversing any tremor, getting their speech back, getting the fluidity of their gait back, and using this multi-pronged approach. It's not just one intervention. So it's using, things that feed the nerve. So first, the assessment, which we talked about, very crucial first step. Everybody wants to know, well, what can I take? It's like, well, if you have metals, you forget about it. You got to get rid of those, because anything that I share here is not going to be effective. And case in point, glutathione, right? We think of glutathione as being a big brain health antioxidant, right? It's the mother of all antioxidants, but it doesn't do anything for somebody that has metals in their brain. David Perlmutter had a YouTube video of a patient of his with Parkinson's like 15 years ago, and injected the glutathione. It was like nothing short of a miraculous cure. This gentleman had tremendous stutter of his voice, weakening of his voice, couldn't walk, that stutter step there, tremor in his hand. And wow, he got a fluid gait, his speech came back, he was louder, projecting again, his balance was there. And I had been doing IV therapy. I put it in on my practice, first 5 patients with Parkinson's diagnosis, nothing happened. Thought, did he hire an actor or what? And that's where I put in the metal component. I just was seeing a different population base than Dr. Perlmutter had down at his clinic in Florida. This was really around, okay, well, I'm seeing more recalcitrant conditions or difficult recalcitrant conditions where people had already been through kind of Mayo Clinic and Cleveland Clinic and seen all the experts. So that's in the book, really on, glutathione. Liposomal glutathione is an amazing nutrient. I talk about the endocannabinoid system. Again, didn't know about that when I went to medical school in the late 90s. Have one of my heroes is Professor. He discovered the endocannabinoid system out of Israel. Great YouTube video called The Scientist for him. Professor Machulam, thank you, Brain, for coming through. But the endocannabinoid system, we have more receptors for cannabidiol in our brains than all of the other neurotransmitters, which is like mind-boggling. Like there are so many neurotransmitters, and there's even more receptors for cannabidiol or CBD1, central nervous system. CBD2 is peripheral nervous system. And so that would be like hemp oil or CBD oil or CBD THC blend, depending, again, what's going on with you. Other things, omega-3 fatty acids are amazing brain food, right? They're anti-inflammatory. They help with your memory. They help with your mood. They're a powerhouse. We don't get enough of those in our diets living today. And so it's important for us to look at just the nutritional deficiencies that we have, but then also specifics like the B vitamins, right? Everybody knows about B12 for brain health. Well, you take that with an activated folate. You may want to get your MTHFR pathways evaluated to see what's the best form and, how are you methylating and detoxing your body? So, that's what I put together in Shake It Off. Up to then the C, which is the cellular regeneration. And so some cutting edge therapies that I uncovered were the regenerative stem cell therapies. We do an intranasal stem cell procedure, and we treat people with mesenchymal stem cells that can differentiate into neurons. It's really the body healing itself, given some information. Exosomes, which are anti-inflammatory and increase growth hormone and growth factors in the body, which exosome is out of the some cell. So these are little healing packets that the stem cells secrete. And then peptides is a huge up-and-coming therapy that I'm very excited about. These are going to be bigger than bioidentical hormones, I think, because they're really safe. They signal specific pathways, and if you don't need them, they don't go there. So it's not going to override your system. So the peptides, are really huge for longevity and brain health. Photobiomodulation. This is pulsed electromagnetic frequency and low-level light or laser therapy, right? These are like really frontline stuff. Hyperbaric oxygen. It's how to perfuse your brain with oxygen and get it to heal again. You know, I've got Dr. Amen right up here, I-5. He's up close to Seattle, just north of where I am here in the Northwest in the States. And you know, I took Soraya up there and we got a SPECT analysis of her brain, and it was showing stress trauma as a root cause of what was going on for her, with the limbic system totally lit up at rest. And so, you know, the hyperbarics, though, he's got case after case after case of brains coming back to full color and perfusion with oxygen. And that's, you know, our bodies love oxygen. So the hyperbarics is really important piece of that too.
Fantastic. Well, thank you for bringing all these strategies into people's awareness. That's really, really great. And I'm assuming that you obviously covered all of these in the book.
Yes, that's all. So that's in that fancy approach. So that's the stack basically, and it's ever evolving as we make better and better improvements and strides for our patients.
Fantastic. That sounds great. So yeah, I'm encouraging everybody to go and check the book out, and I've seen it on Amazon, so
yes,
that is where we're sending everybody. Excellent. So yeah, I just wanted to thank you for everything that you've shared. You definitely have a massive passion for this. Is there anything that you still want to add to what you've already covered, or maybe some, you know, final words of advice or wisdom for the viewers?
Yeah, so the one component I realized, so this is one just take home that you can start implementing today. We know meditation and mindfulness changes your brain. And in the deep breathing that Dr. Eva teaches around the vagus nerve and just getting quiet and with yourself, you have the answers in you, right? We are going to filter all this information through your apparatus, which is you. And I want to just make sure, like, there aren't secrets out there. There is really, we have the answers in us. The answer lies within. One of my favorite songs from Cat Stevens is true. That is the reality. And so I really want to encourage your listeners, viewers, is really get into a mindful practice of maybe it's just 10 minutes a day of deep breathing or watching the breath go in and out of your nose. But just sit quietly with yourself and see what comes up. Oftentimes I see my patients and they're saying like, oh, I'm just so restless, I can't do it. It's like, you know, it's kind of like the old Gandhi quote, you know, when he would meditate an hour a day, unless he had a really busy day, then he would meditate 2 hours, right? It just makes you way more productive, but it's also grounding, it's centering, it's honoring you, and you have the answers in you, your higher self, etc. That still quiet voice in you, that's what we need to be listening to in this day and age. It's time. So just get centered, start the meditation, the breathing. That's going to help your brain regrow itself. So with that, many blessings to you. Thank you for having me on your show.
We thank you so much. You are awesome. We absolutely love your enthusiasm and your passion. Thank you so very much on behalf of myself and everybody else who's listening and watching. Thank you, Greg.
Thank you.